Hi, I'm Daniel Nyman. On behalf of the Forum for Healthcare Strategists, as well as our colleagues at Optum, welcome and thank you for joining us. Growth for health systems is not easy, and the shift to advancing technologies is making it even harder. While growth can come from many different angles, including new service line offerings, improved patient outreach, and everything in between, data often plays a crucial role in the success of these initiatives. Today's webinar explores the power of predictive data. We'll hear how marketing leaders at MetroHealth leverage data and consumer insights to analyze their market and reach patients that are likely to need specialty services. The results was a 70-to-1 return on ad spend. Before I turn the program over to our speakers, one quick note. Attendees are participating in listen-only mode, but you can still ask questions. If you have a question, please enter it into the question and answer pane located on the bottom of your screen at any time. We will respond to as many questions as we can in the time we have. With that, I'm pleased to introduce Danny Fell, Senior Strategist at Optum, who will be leading today's discussion. Danny?
Hey, thanks, Daniel, and thanks to the Forum for hosting the webinar today. I'm Danny Fell. I'm really pleased to be joined by Aimee Smith and Brian Wiszniewski from MetroHealth. They're going to be talking about how they're using data-driven strategies, or you could call it precision marketing, to help drive some outsized growth for their organization. So Aimee and Brian, I'm really pleased to have you guys join us today.
Great. Thanks for having us.
Yeah, so why don't we start with a couple of introductions and get to know you all a little bit better, and then we'll talk about the organization in a second. But Aimee, I'll start with you.
Sure. Hi, everyone. Thanks for joining. I'm Aimee Smith, the Marketing Director for Clinical Services at the MetroHealth System. A little background on me. I've been in healthcare marketing longer than I like to admit. I started at a community hospital in 1999, which was Lakewood Hospital, back when they first joined the Cleveland Clinic Health System. I was able to learn and grow in various positions and different regional hospitals within the Cleveland Clinic Health System for 11 years. Then in 2010, a new opportunity became available at MetroHealth, where we could essentially build out a strategic marketing department. I've been there since in various marketing leadership positions, primarily supporting our clinical service areas.
Great. Thanks, Aimee, and love your background. Brian, tell us a little bit about you.
Hi, everyone. Thanks for joining us today. I'm Brian Wiszniewski, and I'm a marketing manager for clinical services with the MetroHealth System. I've been with the hospital for a little over 10 years, and one of the things I primarily focus on is spearheading the deployment of all of our marketing emails to help drive patient acquisition, retain current patients, and increase share of wallet.
That's great. Brian, we look forward to hearing some of the work that you're doing around one of your particular service lines that you and Aimee have had great success on. But before we do that, let's talk a little bit about MetroHealth and the market that you're in, so folks have a good grounding in what you're doing and what the organization's mission is. And I think I'll turn it to you, maybe Aimee, to start.
Yeah, absolutely. So as you can see on the slide, we are the safety net health system for the most at-risk members of our community. But in addition to that, we also are dedicated to offering the very best care for everyone through clinical excellence, research, and innovation. We've had a busy year and a half here. In 2022, we opened a new behavioral health hospital, as well as our new main campus hospital, which you can see here on the image. It's absolutely beautiful. We've also opened a new birthing center and NICU earlier this year. As an academic healthcare system, our staff physicians hold faculty appointments at Case Western Reserve University School of Medicine. We have some of the best researchers in the country. As an example, we're #1 in NIH funding for physical medicine and rehabilitation. We also just opened a new state-of-the-art vector and cellular lab facility earlier this year. Additionally, our day-to-day where Brian and I spend a lot of our time is supporting the various areas of clinical excellence, such as rehabilitation, weight loss surgery, weight management, neuromusculoskeletal services, OBGYN, and many others.
That's great. And can you tell us a little bit about the marketing structure, how you're organized as a marketing department, what's in your group versus maybe one of the other groups?
Yeah, sure, of course. Our marketing department is led by our chief marketing officer, of which clinical marketing, brand marketing, events, and web all roll up to. On the clinical marketing side, I have a small but mighty team who's responsible for working closely with our clinical service areas to increase awareness, loyalty, generate leads that support operational growth goals. Additionally, our team manages several marketing-owned media systems, such as our web-based blog site, our monthly e-newsletter. We schedule and organize monthly virtual health talks, as well as our email marketing efforts. We also manage and leverage our Optum relationship to integrate all of the precision marketing you're going to hear about today and consumer analytics that support the design, segmentation, tracking, and targeting of our marketing programs. Brian, do you want to kind of weigh in as well?
Sure. So when it comes to marketing, our departments, as Aimee said, we do a variety of different things depending on what their business goals are. So this can range from something as simple as a social media post to promote a new provider or a new health center to a more comprehensive plan that incorporates paid and owned media. So being a public health system, when marketing funds can be sometimes limited, I think one of our top priorities is to be as targeted and strategic as we can be with whatever tactics we are recommending. So I would say that's kind of where the data driven marketing comes into play. Internally, we gather as much data as we can, whether it's from market intelligence or strategy or our finance departments. And then obviously externally, we partner with Optum. So we try to gather as much data as we can from as many sources as we can to then come back and make a sound recommendation to our service lines on what's really going to make the most impact for them.
Yeah, that's really helpful. And how have you guys been using data-driven marketing to now? And I know people define that differently because there's so much data out there and there's different ways of using it, but how do you guys think about it and sort of what's that journey look like for you?
So, we use data from the very beginning. We want, as soon as we are asked, that there's a marketing initiative or a business growth goal, our first step is, okay, what data do we have to help inform the decisions that we want to use to make sure that we are getting the right message to the right patient in the right way. So that is really kind of our motto as we move along. And we try to, as we'll get into a little bit more, we really tried to bring the clinical areas along in that journey so that we're all on the same page and we all have shared vision and goals, and we understand what success is going to look like. And that data really helps us get there.
Yeah, and I think you guys are going to talk a little bit about how you partner with the service lines, with other groups within the organization to get to that success. So I'm really excited about that collaborative piece of the conversation. Let's jump into the topic itself. And we thought, Brian and Aimee and I thought it might be good to level set a bit around what we mean by predictive data. And maybe I'll take this piece of it and then hand it back to you guys for some input and commentary. But generally, we're all hearing a lot about artificial intelligence or AI today in the news. The reality is that some forms of AI have been around for a long time, like machine learning. And that's one of the ways that we can leverage big data to form predictive models or algorithms that help us understand patterns or predict outcomes. Here at Optum, we're using data science to build these mathematical models, if you will, on really vast amounts of clinical data, claims data. And when a model is built and tested and proven, we can then apply it to other sets of data. So that could be a consumer database, for instance, or as you'll hear, a patient set of data. And when we do that, we're able to build better understanding of the likelihood of certain healthcare needs or the likely conditions that those individuals might have in a more nuanced way. And so it's taking personalized or customized marketing, which has been around for decades, and applying some of the more modern analytics tools that allow us to be more relevant to the audiences we're engaging with. And the result is that we get higher engagement rates and engagement from consumers who really benefit from the healthcare communications they might be receiving from healthcare providers. So that's a little bit of a simplistic view of it, but I wanted to make sure that the folks dialing in sort of had that level set. But Brian, do you want to talk a little bit about how you guys are using this and applying it?
Yeah, absolutely. So I think that's a really great overview. And at MetroHealth, we're leveraging the propensity models that you had on that previous slide and combining it with our own patient data. So that really allows us to achieve the targeted outreach that we want. And we found that it might not always cast as wide of a net, but it's really helping us reach the right people, which in the end leads to better results.
And some of those additional things like segmentation or personas or allow you to sort of understand those audiences, right?
Mm-hmm.
Yeah, so let's talk a little bit about that process. And before we jump into the specific case study that you guys have put together for us, maybe talk a little bit about how you go from some of that data, some of those insights, to sort of formulating the campaign or the strategy itself. And I don't know, Brian, if you want to speak to that in a little more detail.
I could. Do you want me to take that one, Brian?
Sure. Yeah.
Okay. And for this particular case, just taking a step back, this was a system-wide initiative that would essentially optimize OR time and allow for increased surgical cases. There were priority surgical areas identified that needed to increase volumes. So with that, there was a multidisciplinary operational team that identified those priorities, set volume growth goals for various procedures. Marketing was pulled into the process from the very beginning, which is extremely helpful. I think we could all relate, when we get those calls at the very last minute, like, oh, we have to build, 100 cases in a week, can you give us a marketing plan? So we were very grateful and appreciative that we were brought in early. But as the operational enhancements were being made, we had time to meet with the clinical areas to further understand the types of procedures they wanted to grow and what that patient journey looked like. So during this time, we also started gathering the data insights, right? Both internally and actually externally to inform our campaign strategy. For instance, we worked with Optum to pull the propensity models to help define our target audiences. We are looking at prospects and patients. What did the audience segments start defining what those look like? What are the healthcare needs, the attitudes, and the behavioral profiles of the different areas that kind of fell into the operational objectives at hand? So we then were able to leverage all of those insights gathered to inform the development of the multimedia marketing strategy that aligned with, again, that right message to the right consumer in the right way that could be measurable as well.
Let's just realize I was on mute. So that's super helpful, Aimee. And I think it's also, we don't want to understate the importance that the data plays, but it's the whole process, right? It's not just the data itself that is sort of the single defining piece of that. And that was really helpful. Let's turn and talk about the service line that you guys have been focused on for some of this campaign work, and that's the Spine Center. And maybe a little background on the Spine Center, but sort of where you all were with them for putting together objectives and what the key outcomes were. And then we can talk a little bit more specifically about the process itself.
Sure. So as mentioned, this was, multi-area of different surgical procedures that the system was focused on. But this particular, when we were looking at the Spine Center, as part of this operational initiative, they had a goal of 979 cases, but they were also asked to increase from what their set goal to additional 58 surgical procedures. So once we understood what the business growth goals, we were able to establish, two simple marketing objectives: build awareness around the spine center and to drive qualified leads that would most likely convert to scheduled appointments. As many of us know, it's important to establish goals and objectives that marketing can actually impact, like generating leads. As a rule of thumb, I try to stay away from volume numbers as marketing goals. There's way too much out of our control that impact volume, such as staffing and access. We wanted to develop a measurable multimedia plan that leveraged owned, earned, and paid media. And we were given a fairly conservative budget to accomplish those goals. So using precision marketing data, we were able to be more targeted in our efforts, focusing on prospects and patients who are most likely to need spine care and were most likely to actually take action, with any, marketing assets that we were able to deliver. We also were able to share the insights along the way with our clinical leaders and business partners. So this process really helped establish trust and credibility that we were actual strategic partners to help them achieve their goals, not just brochure order takers and flyer makers that, we all get, at the last minute, that we are true business partners in this process.
That's super helpful. Let's dive down into that a little bit deeper. And I know you guys brought a illustration of a patient journey, and it's something that we hear a lot about people that are working on patient journeys. They're interested in how to get to a patient journey. This is some work you all did in collaboration with the Spine Center. Do you want to tell us a little bit? We don't have to go through it in detail, but maybe tell us a little bit about that process and how it helped for the precision marketing planning that you were doing.
Sure, absolutely. So I'd start off by saying collaboration across the system and constant communication is definitely key, as Aimee mentioned. And as you can see from this patient journey map, marketing can definitely feed the funnel and bring those patients along the journey so far. But at some point, the journey is no longer in our hands. So it's really a partnership with that service line because they own the rest of it. So when you look at this slide, the 4 icons on the left kind of show the journey at its highest level. And it starts with what we've already discussed. So things like market analysis, the audience segmentation, and then executing those targeted tactics. And then once it gets to the patient conversion piece, that's the entire process that takes place outside of marketing's hands, right? So it's really important that the service line is brought into the conversation early on. And that ideally results in a patient coming in for an appointment. So the map we show here is specific to what a patient went through in our spine marketing. And we found that with other service lines, if they didn't really commit those resources up front to the patient conversion piece, marketing might have been successful in terms of filling the funnel, but those might have been lost opportunities once it came to converting them. So once again, it's really important with the collaboration and the buy-in from the service line up front, along with regular communication throughout the campaign that resulted in success for us in this specific example.
Yeah, and a really good example. And I should have prefaced it by saying that folks who registered will get the slides. So don't panic. There's a lot here to absorb, but you guys will get a copy of that slide, and we'll have a chance to look over it. So let's turn a little bit and talk more specifically. You alluded to, Aimee, how you use the insights and the data to help form not only different segments of audiences, but messaging. And we're going to see some examples of messaging in a minute, but let's talk a little bit about that process itself. I know that you did some of that work in collaboration with some of our team. A shout out to Sean Tardrew, who's one of our consumer analytics experts who works with you. But maybe tell us a little bit about what goes into that and what your objectives are in that part of the process.
Sure, yes. Shout out to Sean. He's great to work with in the team. Although the Spine Center is multidisciplinary in nature, offering medical and surgical treatment options, the business objectives were very clear that we really needed to focus on driving surgical volume. We worked with Sean and team outlining our objectives at hand. We talked through it. We had really good kind of brainstorming sessions, and the team was able to help us identify the right predictive models of people who would be most likely to need surgical, people who are most likely to need surgical treatment for the spine issues within that propensity model. We further narrowed in on demographics and health behavior modifiers such as age and the healthy attitudes and people who are most likely to be proactive in managing their health. And then we also did filter out people who recently had spine procedures over the last 24 months. So with that, we landed on a few unique segments of patients, including the Feel Good for Family campaign. So that was patients and consumers likely to need spine care to remain active for their families. And then also kind of this Reclaiming Retirement campaign. So those were patients and consumers likely to need spine care to remain active and enjoying retirement. That really helped influence. So not only did we have kind of that right audience now, but it then really helped us narrow in on what did our messaging and visuals kind of need and where and how to deploy those visuals and digital assets in the market.
And I really like that you gave some examples, Aimee, of building custom segments. And that's a question we get a lot, right? There are lots of sort of predefined behavioral health segments and generational segments, but the ability to use some of that to inform building like a custom segment, like you just described a couple you all built, I think is a really important point. You're not locked into using sort of preset segments or audiences. It's going to vary by service line and you want it to. And so being able to build those custom segments is great. Let's take a look at some of the creative and the messaging that you all did develop and maybe walk us through a little bit of this. This is always a big part of a campaign because it tends to be the visual part that people see and remember. So I want to give you guys a chance to talk a little bit about it and a little bit about the channels that you were using.
Sure. So for this campaign, we combined an email journey that consisted of 3 emails along with paid social. We took the
I just lost your audio there, Brian. Aimee, are you still on?
Yeah, I'm still on. Can you hear me?
Yeah, I can. Yeah.
Okay. Well, I will pick up where he left. And Brian, if you get back on, certainly jump in. But we looked at the clinical needs of the different areas. So again, we were looking at what were the specific surgical
clinical needs identified by the service line. And as Aimee mentioned, we matched them. It's
that's weird.
Popping in and out. Yeah.
Okay. Okay, so then we made that connection with potential patients and we looked at the symptoms of those clinical needs and made the symptoms the focus of our messaging and visuals. I think sometimes we assume that people have already had the diagnosis, but that was kind of what we landed on too, is that particularly with spine issues, that the symptoms aren't as intuitive, that it really is a neck or spine issue because it's affecting your arms or your legs in different ways that you might not relate back to your back or spine. So we felt most patients probably needed a little bit more education so that it would trigger kind of that, oh, that is me, and I want to be able to schedule an appointment to see, what this is, and I might not have thought of the spine center. So each email and the automation focused on those specific symptoms and for the different clinical need. And then in terms of call to action, was an option of filling out a form to have the service line follow up, or could also call the service line directly. So the form fills in particularly were easy for us to be able to track kind of in real time what was happening with those leads and how they may be converting into appointments with the help of the service line. And from a marketing standpoint, the form was also able to tie nicely into the ROI kind of in real time as well, even though we were using the list, that we were able to pull from Optum. And then the next slide kind of goes more into the social media side of that. So from an email perspective, we really just focused on the patient list. But for the paid social media strategy, we were able to leverage both the prospect and patient list in our targeting. And so we really continue to lean into the symptoms of the targeted diagnoses that often lead to the surgical treatment options. So for instance, people who may experience tingling in their arm may not realize this is a spinal issue, like I had mentioned. So it was really educational in nature. And then you'll also see that the visuals align with the audience segments and campaign themes that I previously mentioned. So the parents being able to focus on their families, or people enjoying an active lifestyle through retirement age. My goal is to be the guy in the kayak sooner than later. But living this nice pain-free or less pain life. We did a variety of A/B testing in the market to see which ads perform the strongest, and then optimize the messaging and visuals throughout the campaign, as we were able to see, which one was performing the best. So then campaign metrics, we created a dashboard that then the campaign net metrics were shared monthly with the clinical and operational teams, including how many leads were generated in each month. As part of that reporting, the service line contact that we were working with, she was also able to provide a report out on which leads she was then able to connect with, who they scheduled an appointment with, and then who actually completed an appointment. And it was a pretty big lift on the service line side, and that's like ideal case. But that truly, I think, was the pivotal difference in rounding out this campaign.
Yeah, and we're going to jump into some of those numbers in a second. You guys were gracious enough to share some of that detail, and we got a lot of questions around how do you measure this? How do you calculate ROI? Before we do, though, I wanted to mention a couple of things that I really liked about what you just said. One is you connected the dots on how do we go from a predictive model to somebody not knowing they have the condition, and you gave a great illustration of that, right? Symptom-based, somebody's experiencing some type of symptoms, and the important point about education in healthcare, right? A lot of our healthcare communications is education-oriented for an individual or for a family member. And then the other thing I really liked is you mentioned the testing of messages and doing things like A/B testing and looking at sort of the campaign in real time to understand what's coming in or what's not, and how to adjust from that. Yeah, really helpful. Do you want to jump into the numbers here?
Sure.
Hey, Brian.
I'm back.
I'm back. I'll be right back.
So as you can see on the screen, these are a sample of the ROI results. And with tracking of ROI, we worked closely with our finance team and Sean from Optum. So as part of the onboarding process originally, when we brought Optum on, we brought finance to the table because they're really responsible for getting our patient encounter data over to Optum on a regular basis. So that was kind of already in place going into this campaign, which was nice. And then we worked with our service line, as Aimee mentioned before, to define what targeted services meant for this campaign. And that was a combination of specific services and specific providers. So we were really able to kind of drill down on our patient encounter data to match it back to the lists that we pulled from Optum CDP. So every month, Sean was able to help in tracking the targeted lists that you can see at the bottom of the slide against our patient encounter data to see who came in because of our marketing efforts. So whether it was the spine emails that Aimee walked through or the digital ads from Facebook. And then Sean was able to pull those findings into the chart here. So you can see there were over 7,000 unique patients acquired to the targeted services that were identified by the service line, with over $8 million in unique expected reimbursement to those targeted services that we identified with the service line.
Yeah, and I think that that emphasis on unique, right? You're not adding up numbers or looking at each one. You're taking them collectively and then figuring out sort of the unique return on that, which I think is super helpful. And CDP, as you mentioned, refers to the consumer data platform, which houses the consumer data, the predictive models, but also the helps in doing the tracking and measurement. Let's go to this next slide too, because you have a little more detail to share with us, right, Brian?
Yeah. So this slide shows kind of a subset of the data on the previous slide. And I think it's important to call this data out as well, because it shows the leads that came in directly from the form fills on our website. And I think those are important to look at because they are on the website which marketing owns. So whether this people filling out that form came in as a result of a brochure that has the URL, or they saw a social media post, or it was the target email that came from our campaign, I think it's safe to give marketing credit for those leads. So I think that's sometimes hard to do when you have a marketing campaign in market, but when it comes in through a form, I think there's that clear connection that we can make and present to different, leadership.
Yep, that's great. And Aimee, did you want to add anything just around the sort of collaboration with groups like finance or others in the organization in terms of how do you get them on the same page about measurement and agreeing to definitions and things like that?
Yeah, I think one of the lessons learned with this, and there was a different campaign that we were really trying to massage to make sure that we are taking credit for the right journey, right? And so I think putting the work in at the very beginning on the attributed, the encounters that would truly be part of, whether it's a spine journey or a bariatric journey, making sure that everyone has buy-in up front from the very beginning, because just makes that ROI reporting more sound and easy, on that quarterly kind of cadence. But, looking at, for spine in particular, we're looking at the journey. It was a medical appointment. We're looking at, diagnostics. We're looking potentially therapy. They may not go right to surgery, but they may end up there. So, that's why we looked at a kind of a longer, it wasn't just like a 6-month report out, right? Because sometimes it takes a while to go through that journey to get to maybe then surgery is a last option. A lot of us who've worked with spine surgeons, they'll say like that should truly be your last option. So there's going to be other options in that process. But so making sure that we're looking at the true, all of that encounter data up front that is part of this reporting.
I like that holistic approach. Yeah, in getting your organization behind that as well. Since you mentioned,
then they know, right? Like you're not coming to them and saying, "Here, this is our report." They know we're working on it. They know they're going to expect to see it. It's not a surprise, and they know what the work that went into making sure that it's a credible source.
Right. I kind of liken it to the restaurant concept, right? You want them to know what you're going to be serving them before you bring it to the table, unless you're trying to do a surprise. But yeah, that's a good example. Since you mentioned lessons learned, let's pivot and just talk about other things that you learned or things that you're thinking about for the future. And then we did have some questions that folks registered with that have been put in the chat as we've been talking, and I encourage you to put other questions in there while we're going through this part, and I'll hit a few of those with the time at the end. But do you want to talk a little bit about some of the other lessons?
I think one of the things that was part of like marketing's fun, right? This is the cool stuff, and this was, there are headaches at times, but being able to go through this process, it was kind of cool to be able to bring a different aspect and different tools to the table, and part of our planning process. Having the predictive models and consumer data insights to make informed decisions on who to target, what to say, and how to say it truly made an incredible difference. As you can see, the results can be pretty impactful, and the process where we're bringing our clinical and business partners along for the ride, I think was also beneficial. And it keeps the leaders involved. And like I mentioned, like just like creating that buy-in from the very beginning is really important. And then sharing results. We had kind of a process of vetting the ROI report. We first vetted it through our chief marketing officer. We then shared it with the center director of the spine center, anything that, he was concerned about or not concerned about, or we all kind of, relooked at the different data points that, impacted that report. And then once everyone felt comfortable, we then shared it out with the service line chair and the executive administrator. So I would just, say that too. Again, it's just kind of that transparency and continued communication.
Brian, Sean wanted me to make sure we hit on control groups too. How did you think about those? And was that helpful as part of the measurement process?
Yeah, I would say control groups are always helpful because that helps kind of validate what you're doing. So when you're looking at the ROI results, it shows kind of when you have those control groups, there's that lift on the targeted lists, right? So I think it's important to use those when you can.
Yeah. And just for folks on the call, what we're referring to, if you're not familiar with that or you haven't done control groups, is you're taking a targeted list and taking a small portion of those aside who don't receive the marketing communications and measuring that against the larger group. Pretty common in a lot of marketing practices, but the ability to do it at this kind of granular level can be helpful. What are some ways you guys are thinking about going forward in the future using data-driven marketing? It doesn't have to be specific to this, but what is on the roadmap? What are you thinking about? What are some other ways that you guys are leveraging data in general?
I think, it's just become, particularly if we have marketing budget, any campaign that we launch or start, our first step is to ask questions, right? To identify what those objectives are and to call Sean. I think, we are able to really, we want to be able to hone in on those segments and the right audience, so that we can really show that we are being as thoughtful and strategic as possible, particularly, with the dollars that we have to be able to make an impact. We're not only from a clinical marketing service line marketing approach, but where could we be going out into the community to offer screenings? I think we're trying to think even a little bit more broadly, as we move forward.
Yeah, that's super helpful. So we intentionally kept the presentation part pretty compact because we knew that we'd get some really good questions, and maybe we can jump into some of those now. And I'll use a combination of ones that folks have submitted when they registered, which was part of the registration form, and some that are coming in now, and just maybe some additional points that you guys would like to make too. But we talked a lot about ROI. As I said, there's a number of questions in there about how you think about it, how we measured it. But I feel like you all walked us through that process. Is there anything you want to add there, or any advice you would give folks when it comes to measuring ROI in general?
I would just reiterate what we said earlier, meeting with those service lines and finding out specific providers and specific procedures that they consider a win for the campaign, right? So that way, when you're going back and presenting these numbers to them, they're not questioning how you came up with them. And I think it just helps make your case stronger if you collaborate with them earlier on.
Yeah, makes sense. We had a question about staffing, like what staffing is appropriate for this level of targeted marketing. Do you think about staffing differently? How critical is it to doing things like the data-driven marketing today or the analytics?
I would say twofold. One, I think this is just part of marketing. I think it's not one person's responsibility to be thinking of strategic planning in this way. It's part of how we plan, but what I do think made a difference was we were able to hire one extra person. So that allowed us to have Brian be the subject matter expert. So even though we all had some responsibility and we needed to be thinking about how we use precision marketing in our planning, he was able to help. He was our first internal go-to to ask questions and for him to be kind of that super user in our efforts. So I do feel like when we made that shift in our staffing, it really made a big difference that he kept us going and kept us on track, along with Sean.
Great. Good shout out there. We've gotten several questions about CRM, customer relationship management tools or programs. Can you talk a little bit about what you're using, how you're using it, how you think about CRM in general?
Sure. So I think everyone kind of has their own definition of what a CRM tool is and how they kind of use it. So I'll just speak specifically for us at MetroHealth. We kind of use two tools in tandem. So obviously partnering with Optum to get those propensity models for our own patients and pulling lists and propensity lists for targeted outreach. But we also use a platform called Active Campaign, which is really what we use to push out all of our messaging to our patients. So all of our marketing emails go out through Active Campaign. We also use their platform for the form. So the form fills that we talked about earlier with this campaign specifically to track people coming in. So when people would fill out the form, it's an Active Campaign form. I would then pull the report of who filled that form out and send it over to Sean, who was able to then kind of track against ROI. So in our situation specifically, we're kind of using both of those platforms at the same time.
Makes sense. And we had some kind of related questions. One was around whether you have a central appointment call center. I assume it was appointment center, but do you have something like that in the organization that handles inbound? And then sort of a related question to the CRM one around, are you doing nurturing campaigns and is any of that automated? I don't know if you want to take those together or separately, but.
From a call center perspective, I mean, I don't know if that's meaning like for marketing specifically, and if it is, no. But so when we're looking at, so calls are a little harder to track, right? That's why, until you get to the back end ROI reporting, that really helps kind of close the loop. So even if you have someone who, maybe we targeted but didn't fill out a form, but they were on our list, and they ended up, their journey was through a phone call. In this particular case, the Spine Center has their own kind of little call tree and call center. But on the back end, you're able to see if that patient ended up scheduling an appointment, having an encounter, right? So it really then kind of rounds out that. That's the benefit of using the lists that were, pulled from Optum to then kind of round out that ROI as a whole. So we don't really have like a marketing call center, but it is more like a system call center.
Yep, that makes sense. And I don't know, Brian, do you want to speak to the nurturing campaigns? Again, for the folks who maybe aren't as familiar, a certain percentage of the people who engage, right, aren't going to necessarily turn into patients right away. In fact, Aimee, you made that point, it can take months. You want to stay in touch with those people. They might request information. How do you guys think about that? And how do you think about sort of staying in touch with the ones who are maybe active leads or active prospects, but haven't necessarily quote unquote converted yet?
Sure. So I think for this specific campaign, we haven't done any nurturing campaigns yet, but we're definitely exploring those. I will say just in general with our email sends, we have found it successful to do a resend. So that's kind of a way that we kind of nurture warm leads. So we'll do a resend to people that didn't necessarily open that first send with maybe a different subject line or a pre-header to kind of get their interest. And we see that is successful for us in getting more eyes on our messaging. So I think to the point of a nurturing campaign, just trying to re-engage patients with maybe the same or similar messaging will help you gain more leads without really having a very heavy lift.
Yep.
And to Brian's point, we are, that's kind of like our next step. There's a different service line that we are actively pulling together a nurturing campaign for people who may have raised their hand, they were interested, but aren't quite ready to convert to that first appointment yet, that we are excited to kind of see, like, how can we, what we're actually developing the content right now and just trying to pull that right segmented list in the right time of their, like, when they, is it 3 months, so that kind of like time of when to start reaching out. So maybe next year we'll have a nice report to tell you about how that went.
And we'll have you back. We'd love to. Hey, here's a great question that I love. It kind of speaks to my heart with my background in agency work. How do you think about the brand, so MetroHealth specifically, and its importance to something like a direct marketing or a digital marketing campaign? I think I know what you're going to say, but I know you're in a very competitive market. So just kind of curious how you guys think about the importance of the brand.
Well, we, over the last, it's been 2 years now, we just launched a new brand and altogether, new graphic identity, everything new. So it's really, you'll see the visuals that were part of this campaign were on our old brand. And now moving forward, obviously that is all in transition. So I think staying true to the voice, I actually think it's having more of this like predictive and understanding a little bit more of the segments of our audience helps bring our brand to life even more, because we're really around people, right? And that's what it's all about. And we make such a great connection, and MetroHealth is truly invested in our community and everybody in our community. And to be able to personalize these messages in a meaningful way, I think just helps elevate our brand even more.
That's great. With just a couple of minutes remaining, let's give you guys each a chance, if you'd like, to maybe have one last piece of advice for folks who are listening in. I know that we have a really diverse audience. There are folks from marketing, folks from technology. There are clinical people on the line. Just any advice in general that you would give to folks who are thinking about this, maybe you're just starting down that path, anything that you want to share with the group. And then we have just one parting, something else to share, and then we'll wrap up. But Aimee, do you want to go first? Anything you'd kind of wisdom that you'd share with folks?
I think just being transparent, right? That you're trying, like, especially if this is new, being transparent that this is new, and having those conversations with, your leader, your business partners, and saying, listen, we have this new tool that we are able to now access to help better influence our campaign. I was so excited to work with you, and being a part of that. People, especially I think in healthcare, people love to be, the first to try something, and that generated some excitement. And I think it's just how we're positioning it and not being, scared to think that we have to have all of the answers, and that we're learning along the way. That I think just level sets expectations right up front as well. So again, I think making sure that everyone is just very clear on what success looks like, how you get there, is a ride, and keeping your eye on the ball is really kind of the driving force.
That's great. Brian, I'll give you a chance too to weigh in on anything you would like folks to know, or parting words of wisdom.
Sure. So I would say buy-in from your stakeholders from the beginning, and communication throughout the entire process are key to having a successful campaign. I also think that it's important to remember with digital tactics, especially, that nothing is set in stone. So, you learn as you go and make tweaks as needed. I always like to say marketing is a bit of an art and a science. So you want to gather as much data as you can and try things out. And you just need to be comfortable changing direction if you don't exactly hit the mark the first time. So there's always room to make changes.
I think that's great advice for folks dialing in. Aimee and Brian, I really want to thank you all for doing the webinar today, for being partners with us, for sharing a little bit about the journey that you've been on some of this work for the Spine Center. We'd love to have you come back and talk with us about other stuff you're doing and sharing out. I know there were some questions that we didn't get to. But we're happy to, if you want to, we can try to follow up with you all with some post questions. You'll get a copy of the presentation. The audio recording will be on demand. So I know all that's going to be there. I'll share one last thing just as a thank you. Optum has put together a quick resource that you can log into if you're interested in seeing how some of this data looks in your local market. We'll do a quick analytics report for you at no charge, and that website link is on the screen, but it'll also be in the materials that we send you guys. So again, thank you so much, Aimee and Brian. It's a great story from MetroHealth. I'm going to turn it back over to you, Daniel, to wrap us up.
Thank you, Danny. I'm sure the audience joins me in thanking you, Aimee and Brian, for that terrific presentation. And thanks also to all of you in the audience for carving out time to join us for this important conversation. As Danny had mentioned earlier, if you asked a question that we weren't able to get to, we'll do our best to get a response to you. And also keep a lookout for a link to the webinar recording that will be sent in the next couple of days. Finally, be sure to give us your feedback by completing the evaluation survey as you exit the webinar. We look forward to seeing you at future webinars, as well as the Healthcare Marketing and Physician Strategy Summit next April in Las Vegas. Check the forum website at healthcarestrategy.com for details. That concludes today's program. Thank you and have a great day.